So today we have Dr. Kendrick Johnson on the podcast. Dr. Johnson is from ARK Family Health. So Dr. Johnson, thanks for coming on today.
Thank you.
Excited to have you here. So first off, would love to hear a little bit about, you're in family practice, correct?
hmm
Obviously you do things a little bit different than the standard family practice doctor. How did you get into family practice? What was exciting about that? And we'll go from there.
Sure. Well, I always wanted to be a physician, and I had this idea that being a physician meant I could help people prevent suffering and reverse suffering and be healthier, happier. And I thought that being in family medicine would give me the ability to really help people before they got into an operating room or a pain management clinic, for example. So family medicine just felt like where I could make the biggest impact.
Mhm. So you are part of the Free Market Medical Association, I believe. So,
hmm
like, what is that, and how has that made a difference for you?
Yeah. Well, the Free Market Medical Association was founded by Keith Smith and Jake Kempton. And Keith Smith was an anesthesiologist who had a surgical center called the Surgery Centers of Oklahoma. And this center did the unprecedented thing of posting their prices for
Mm-hmm.
procedures on their website. And it sounds like it shouldn't be a big deal, right? But actually, it was a really big deal in the healthcare world to post prices on your website. And this was 15 years ago now ish, and since then, it has become an even bigger deal to uh, be transparent
Mm-hmm.
about what your prices are for healthcare. And so the reason I got involved in the Free Market Medical Association is because our practice also is a transparent pricing model
Mm-hmm.
where we don't bill insurance for anything. We just charge a monthly membership,
Mm-hmm.
and that monthly membership covers all of your primary care services. So it was a good fit for us to be part of a larger organization that really did things outside of the insurance-based
Yeah.
system and focused on providing the service directly to the individual or an employer who might purchase healthcare for an individual.
So I think that's really interesting because there's two parts that you touched on. One is price transparency,
Mm-hmm.
and you said it was a big deal. So I want to talk about that.
Yeah.
The other one, why free market is so important in healthcare and why we don't have that. So let's go to the first one. Why was posting their prices such a big deal? Like, why is price transparency such a controversial topic in healthcare?
Yeah, it's weird that it would be, right? Because we have prices in almost everything else that we purchase. But it's to distill the history of the healthcare system down to a couple minutes, I probably won't do a great job of, but basically when we shifted toward insurance paying for healthcare,
Yeah.
then we shifted away from individuals actually, shopping for healthcare. We ended up paying for primary care services and all kinds of services with a third party instead of shopping around and figuring out what's actually going to be the best for you.
Mm-hmm.
And because of that, there's a big disconnect between how much things cost and what the value really is to the individual. And so by going outside of the insurance-based system, people like Keith Smith at Surgery Centers of Oklahoma and practices like mine, direct primary care practices like mine, we are able to allow the consumer to choose what kind of healthcare do you really want.
Mm-hmm.
And at our shop, that means you get access to us same day or next day. Means that you're never surprised with a bill. You never find out that your labs cost you twice as much or three times as much as you hoped they would. And you're also able to just spend a lot more time with your provider. So in our visits, we'll spend an extra 30-40 minutes with you that you might not get in another office. And now when you're talking about diabetes or back pain, we get down into the causes of the diabetes and the back pain, the nutrition, exercise, and sleep. So those things just aren't on the table when you only have a 10-minute visit. And you only have a 10-minute visit, remember, because the insurance set the prices of
Mm-hmm.
the visit, and there wasn't time for getting to the root of the problem.
So, insurance is an interesting topic, and there's a lot we could talk on
Yeah.
that. But I would like to go a little bit deeper into that. So, how does the price transparency connect to the insurance? Can you bridge that gap for everybody that's listening?
When you're going to be an insurance company and you're going to pay for my healthcare,
Mm-hmm.
you have a couple of things that you want to happen. One, you want me to think that I'm getting a good deal.
Yeah,
And so,
that's good business, right?
yeah. And so when you negotiate prices, you want to be able to say that I'm saving money. So now, when you go to a provider of healthcare, like a hospital system, and you negotiate the prices, one of the things that you want to be able to come back to me, the consumer, and say is that I got you a big discount. And because all of this is happening sort of behind closed doors, and it's not really the insurance company's money that they're spending, they have an incentive to start with a big price
Mm-hmm.
and come back to you and say there's a big discount. So one example of that is a patient of mine needed a mole removed, and because it was a cancerous mole, they also needed a lymph node biopsy. So the facility, I won't say which one, but a hospital owned facility said it's going to cost $30,000 to use this room for an hour
Mm-hmm.
in order to take that mole off. And that price, that $30,000 price, was negotiated with insurance companies. But the nature of this person's individual situation was that they had to pay the first $10,000 of that.
Before they could even go in. Yeah.
Yeah. And then the company that this person worked for was going to pay the other 20,000, and that's before we even paid a doctor, an anesthesiologist, or a pathologist to
That's just the
take care of
facility.
this. It's just the facility. So what what I was able to do in that situation is call up a surgeon that I trusted, and he found a facility that he trusted, and we got the whole thing down to just a few $1,000s. And the patient ended up having zero out of pocket costs because their health plan was happy to pay the the
Significant decreased
the
price.
$5,000-$6,000 instead of the $30,000+. So those are just some of the games really that are being played in healthcare, is that outrageous costs for things that really don't have to be that much in order for us to have the perception that we're getting a good deal or that we're doing something valuable.
So, yeah, there's three parties in healthcare transactions, right? So there's going to be the patient who needs the care.
Mm-hmm.
There's going to be the doctor who wants to get paid. And usually there's the insurance company who has to have a margin between what they receive from the patient
Right.
and what they pay for the doctor.
Yeah.
That's the only way for there to be value for all three parties, right? The patient's
Mm-hmm.
value is getting good care, the doctor's value is getting paid for what they do, and the insurance value is going to be that they have margin between what they pay out for care
Right.
and what they keep as a company that needs to be profitable, right?
Mm-hmm.
And so you're saying that in that whole equation, there's a lot of games that get played that end up increasing costs of healthcare. So I don't think there's anybody listening to this that would say, no, healthcare isn't expensive in America, right? Like we know that we have a problem with the expenses of healthcare. So
Yeah.
how do you think, in your opinion, how do we solve these escalating prices of insurance, the escalating prices of healthcare delivery?
Mm-hmm. Let me start with a way that we've tried to, and tell you why I think that might not be working, and then I'll give you some ideas about what we might do. What we've tried to do in the past is we tried to cap how much insurance companies are able to make
Mm-hmm.
as a percentage of.
Huge problem.
Yeah.
I know. Keep going. I know exactly the problem with this, but keep going.
Okay, so when you give an insurance company $100, the law says that that insurance company can only keep $15
$15, yeah.
of the $100. And so the insurance company, of course, they want to make money, like you said, and every business can and must make money in order to stay afloat. So, but they also want to grow. They want to make more money than they're currently making. Well, how do you make more money when you are capped at a
The
percentage?
only way to do it is to make things more expensive.
Right? That's the only way that it can happen. So, for me, this is kind of like when in India there was a snake problem, and they said, okay, in order to fix the snake problem, we'll give you $5 for every dead snake you bring in.
Mhm.
Well, what happened with that is after that law was passed, people started breeding
Snakes.
the snakes and bringing them in dead. And then the government finally realized, okay, we caused a bigger problem. And so they said, okay, no more. We're not going to pay you for the dead snakes anymore. And so everybody just let their snakes go. And the original problem became much bigger
Hmm.
than it was before because of the simple fix to a complex problem that that the government tried to put in place. And so, I'm not saying that the only thing government can do is stay the heck away from healthcare legislation, but I am saying that it's a much more complex
Yeah.
problem than people who don't work in healthcare are ever going to understand, and people who do work in healthcare are ever going to understand. And many of the legislative band-aids we try to put on it actually probably will make the problem worse. So what's one thing that we do have a history of providing good goods and services to humans with? And
Capitalism.
that's where the market comes in,
Yep.
and a market system has done a phenomenal job, like with the electronics that are recording this thing are are working very well.
Yeah.
They work, surprisingly well, and you're not going around talking about like, well, how come they can't make a phone that works? They
Mm-hmm.
do make phones that work because the market system makes stuff, and we buy it if it's good, and we don't buy it if it's not good.
Yep.
In healthcare, it doesn't work that way at all. We buy all kinds of things that aren't good,
Yeah.
and we don't buy things that are good because somebody else is deciding the prices. And many times, the prices aren't reflected in what we're actually paying.
No, I think that having worked with insurance companies on the back end of stuff, like this is absolutely a problem of um, finding the right incentives for all three of those groups are really important, right?
Yeah.
The incentives for patients to say when you live healthier, the cost to your healthcare goes way down,
Mm-hmm.
right? The insurance companies that say when they actually do a good job incentivizing good care, their costs go down. And then lastly, with providers, if providers offer great customer service and do a good job treating the root cause
Mm-hmm.
and fixing an issue, they should get paid more. But that's not how our system works,
Absolutely
right?
not.
And so
Yeah.
there is the right incentives. There's just not the right structure to align those incentives
Mm-hmm.
with a payer model that solves those issues. And so I 100% agree with that. I do think that there has to be a way for us to go through that. So it sounds like what you're advocating for is you're saying if we allowed capitalism to work and allowed people to say, hey, if a doctor's not good, don't go to that doctor,
Mm-hmm.
right? Whereas right now it's like, well, that's the only doctor that's in network, so that's the only place my insurance will cover, so therefore I have to go there because I don't have
Right.
options, right? And that's one of the key issues of where capitalism is breaking down is because we have networks and we have systems that, as you said, they don't reward necessarily really high quality versus low quality. Maybe the low quality negotiated a better deal and they're actually getting paid more
Mm-hmm.
than somebody that's delivering a higher quality service or product, right?
Yeah.
Um, that's fascinating. I think a lot of people, there's a curtain to where they just know health insurance doesn't work well, or they go, I can't, I don't have anybody that's good in my network,
Right.
or healthcare is too expensive, so I can't get healthcare.
Hmm.
Um, do you feel that free markets will also bring the cost of healthcare down? And
Yeah.
if so, how?
Yeah. Well, it's already happening, and that's the thing that is important, I think, for us to get a message out about is, even though most people are still feeling stuck in this insurance-based system, there are already free market alternatives that exist.
Yeah.
And for example, in my practice, when people come in and they need a cholesterol check, for
Mm-hmm.
example, and we bring them the 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 price before we take their blood, and
Yeah.
we say, "Hey, this cholesterol check costs $3. Do you want to do it?"
Mm-hmm.
And most people don't have a problem with that $3 price tag. Well, why is it $3? Most people actually are confused at a $3 price tag, because literally this same cholesterol panel
Mm-hmm.
can be billed up to $10,000.
Yeah.
I have seen the bill of a $10,000 cholesterol check that's the same exact thing that I'm
That you
providing for
guys do for
three
$3.
dollars. So why are we charging $3 when it could be billed hundreds, or even in rare cases thousands of dollars for the same test? And it's because when when we are purchasing it directly
Mm-hmm.
from the lab, then the lab is not playing all of these games anymore. They're not playing the game of, am I going to get paid?
Mm-hmm.
They're not playing the game of, hey, let's negotiate a price that's up here and then we'll really play down here. They're just selling me a product, just like, you know,
Go to grocery store.
just
Yep.
like a grocery store or a street vendor would. They are selling me this product, and they're charging me about what it makes sense for them to charge.
Mm-hmm.
And if they don't charge, if they charge too much, then I go to the other lab.
Mm-hmm.
And labs are a great example here because I do have options of different labs to go to. So so because of that, the prices come way down. And so now all of a sudden, when you are treating diabetes, for
Yeah.
example, people generally think about diabetes as costing at least $32,000 a year to treat. Well, not if we only charge $1 for your hemoglobin A1C, which you get 3 times a year or 4 times a year, and not if your medication only costs you $1 a month, and then it only costs you $100 a month to see us and take care of you. So now all of a sudden, your whole diabetes management program ends up costing you, a couple $1,000s a year at maximum, plus including all the access to other, other healthcare services when your back hurts and everything else happens.
Yeah.
So it's just not as expensive as the insurance companies make it to be.
So you're saying, if I'm interpreting this properly, you're saying a couple of the things that drive prices down in healthcare that can be used and people are starting to use,
Mm-hmm.
but also a lot of people don't, which is competition, right?
Mm-hmm.
And so competition between labs. If one lab won't give you the price, going to another lab and doing that, and then being able to not be bound by some of the insurance contracts, you can really go in and say, hey, they need to make money, and we
Mm-hmm.
know that.
Yeah.
But what's the price you can do this where it makes you money, but then it's just a simple price? I think one of the things that people are really surprised about, or at least I would be if I didn't know as much about health insurance, is most of the healthcare is not the expense of healthcare is not in the delivery of healthcare, right? What happens is you have massive regulation that's expensive.
Yeah.
You have huge administrative costs, huge billing departments
Right.
just to bill the service
Yeah.
so you can get paid
Mm-hmm.
from the insurance company. All of those costs have to be borne by someone,
Right.
and the company has to be profitable or they can't keep their doors open. And so
Mm-hmm.
what happens is that gets passed on to the patient ultimately. And
Absolutely.
so one of the huge things in bringing costs down that you mentioned that you do that you didn't mention is the fact that because you don't have a billing department that's billing insurance,
Mm-hmm.
you don't have that expense. And if you don't have that expense, you don't have to pass that on to the patient,
Right.
which in turn makes it less expensive. Same thing happens. Well, why can a lab do that? Well, the same reason. If they don't have to bill it to insurance and it's just a straight cost per service, all of a sudden they can offer it at a much lower price. And so
That's exactly right.
I do agree with you that in many ways, health insurance that's trying hard to solve a problem that's needed in our country can create inflation in the costs across so many different spectrums,
Mm-hmm.
whether that's the labs, the facility, which you brought up, the service provider, like the surgeon or the doctor, stuff like that. And there can be a markup on every single one of those
Right.
just because of having to use the insurance company. So let's move on to topics for just a moment. You talked about diabetes. So we treat a lot of people with diabetes,
Mm-hmm.
but we're not treating their diabetes. So at Arizona Pain and Pain Doctor in general across the country, one of the things that's really important for us is treating the root cause. And we see patients that come in with something called painful diabetic neuropathy,
Mm-hmm.
right? So I think the statistics are around 38 million people in the United States have diabetes. One in About 1 in 10 people in the United States.
Right.
Second thing is about 90 to 95% of those people have type 2 diabetes, right?
Mm-hmm.
And so that's an interesting topic I'd like to talk on. But before going there, like what happens then is uncontrolled blood sugar begins to break down the nerves. They get this numbness, tingling, pain in their extremities, so hands or feet. We treat them and we do procedures called neuromodulation or spinal cord stimulation, where we're trying to decrease that painful nerve signal without having to resort to medications and other things that have a lot of side effects.
Mm-hmm.
And so, kind of talking about that, treating the root cause. I know this is something that you believe in, background nutrition, different things like that, as well as being a family practice doctor. What do you feel like? How can we do a better job at treating things early? How can we do a better job of treating the root cause to make it to where patients don't get to the point where they're suffering from these chronic illnesses?
Yeah. Well, I went to a diabetes conference a year ago, I believe, and we spent a full day talking about medications. And at the end of that conference, they had all the panelists, all the speakers up in a panel, and they opened it up for questions. And I stood up at the microphone and I said, "Is diabetes reversible? And if so, why was that not mentioned today?" And I think it was the longest silence I've ever seen at any conference of any kind. It was just like nobody really knew what to say to that. And 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 the reason I believe that nobody had an answer about preventing diabetes or reversing diabetes is because nobody makes money when the diabetes is gone.
Hmm.
We make money when diabetes is there. And I'm not saying that these people are doing something
Yeah, they
wrong,
have
like
ill
they
intent.
want
Yeah,
us to all be sick, but the organizations do need us to be sick to exist.
yeah,
And so all of the efforts, all of the energy of each organization will not be around reversing or preventing diabetes. It will be around creating lucrative ways of treating diabetes,
agreed.
of managing it. And so um, that I think is why it's really valuable in a system like ours, where people pay me monthly
Mm-hmm.
for me to take care of them and keep them well.
Yeah,
And I do have a different set of incentives when you pay me to keep you well, because now I don't want you to get diabetes. It's going to take more time and
mm-hmm.
more money out of
Yeah,
my checkbook if you get diabetes. And so what I want to do then is talk about the root cause of
yeah,
diabetes. And as far as I understand it, and again, because the bulk of science hasn't been focused on this, maybe there that we don't know this answer. But as far as I understand, type 2 diabetes is 100%
preventable and
reversible and
reversible.
preventable.
Yeah,
Well, 100% preventable and probably
near 100%, if not
mostly
100%. Yeah,
reversible. Yeah.
reversible.
And so, and how do you do that? Well, you could look 100 years ago and see that there was almost no diabetics, type 2 diabetics, 100 years ago. And why not? Well, they had a different environment that they lived in. That environment had different food available to them,
Yeah,
and it had a different
lifestyle.
lifestyle, including more stuff you had to do with your body, so you had more work for your metabolism, and a, a total absence of the refined foods that we have today, the processed foods that make up most of the American diet.
So there's two things that you touched on, and I want to talk on both of them because I think they're fascinating. So one is we don't have a healthcare system; we have a sick care system.
Right.
Like 100%, it is all about saying if people are sick, that's where money's made.
Mm-hmm.
Like the system does not make money if people aren't sick. So why
Right.
would like where's the incentive on a global level to develop products, services, drugs that actually get people healthy? Like the
Yeah.
financial incentive is not there. It's and again, I agree with you also that I think there's a lot of really well-intentioned people out
Mm-hmm.
there that it's not like this maligned organization out there being like get everybody sick.
Right.
It's not to say that there might be people that don't think that way,
Right.
or that do think that way. But ultimately, where research dollars go
Right.
are going to be where there's a return on investment. And where that is what you said, which is managing or creating drugs that manage them in their sickness
Right.
rather than necessarily fixing it. And so, as far as that sick care system, what you mentioned is when you're doing like in the free market medical association that you're in, it's very much your alignment of incentive is the sicker you are, the more time it takes of your time. And if
Right.
you're saying that I have a monthly membership, that
Mm-hmm.
means if somebody's healthy, it may take me a nice 15-minute call once a month. If
Right.
someone's sick, it might be hours of time. You have a
Right.
full incentive to say, let me help you to get as healthy as possible.
Mm-hmm.
Whereas the rest of the system doesn't have that same incentive. So why would they solve the problem?
Right.
So I do think that alignment of incentive changes dramatically how we deal with healthcare. So how can we make that more common throughout healthcare? Because obviously we want people to be healthier. As doctors, we want people to be the healthiest they can.
Mm-hmm.
How can we make it much more prevalent to have that aligned incentive that you have?
I really think the opportunity is already there
Mm-hmm.
for people like me who have a business that uh, that is better aligned with the incentive to help people be well. The opportunity is there for us to just help people understand there's another way of doing it. So, most of my friends who went to medical school are working for a hospital system. That's the that's the path that's just it's the path of
It's
least
open. Yep, it's
resistance.
open and
Yeah.
it's waiting. Mm-hmm.
and and there's good reasons for choosing that path. I don't think very many of my friends would have liked to choose the path that I took. However, there are great rewards on the path of creating something new
Mm-hmm.
that really meets people's needs, and those are rewards like potentially, uh, you could end up making a lot more money by doing something that people really need that
Yeah.
doesn't currently exist, and also just the feeling like you're doing something of value. And so I think I need to do a better job of letting humans know that there's an option out here like this, and that and also other providers of healthcare can be thinking, well, what can I make that will really help people be well and
Mm-hmm.
also make money? Because if I end up doing very well in this, more people are going to want to do the same thing, and patients are going to demand the kind of care that they get from me,
Yep.
from the places they're getting care already. So once it gets out that you can actually spend 45 minutes with your doctor, and you can see them the same day and next day, and you won't be surprised by the bills. Once that secret starts leaking into the community, then people are not going to be as happy with waiting 2 hours for a 5-minute visit.
Yeah.
It's not going to be an acceptable option anymore, and the pressure will be on the system to change.
Well, I think there's massive pressure on the system to change now. I don't think people like where health insurance prices are going. I don't think if you, polled 100 people
Mm-hmm.
and said, "Are you happy with your health care?" I don't. I think it'd be 95% of the people say like, No, they're not happy with their wait times.
Mm-hmm.
No, they're not happy with their the amount of time they get with their doctor, which you brought up. I don't think they'd be happy with the price that they're paying for that care. So
Yeah.
all of those things, I think there's the dissatisfaction that normally brings about change. I think the difference is though, and there's the money too, because you look at healthcare's trillions of dollars in America
Mm-hmm.
that's spent on that. So if you have the money that usually backs change, and you have the desire that usually backs change, why aren't we changing?
Yeah, I don't know if the incentive is really there for the major players in the system right now. As
So the
as
money's there and the patients want it, but the people that control the system don't have the incentive.
Right. Well, as broken as everybody seems to agree the system is,
Mm-hmm.
it's not broken for the people who designed it.
That's a good point.
They're making more money than they ever have. And I'm not saying that they should wake up someday and say, "Well, I'm going to shut down this business or I'm going to do something differently that's going to kill all my profit margins." What I'm saying is that somebody, and as many of us as possible, should find new ways of meeting the needs of the patient that ultimately puts financial pressure on the existing system,
Mm-hmm.
because they see the money going out the door
Yeah.
into alternatives. And we're seeing that in small degrees,
So
like with that case I told you about of the surgery on the
yeah,
arm. Enough of those cases disappear from the hospitals, and the hospitals are going to start asking questions
yeah.
about what
So
can we do
you're
different.
saying where we can take that power back is voting with our dollars.
Absolutely.
Like that's where we have that power. Is right now there
Mm-hmm.
is trillions of dollars that are going into healthcare,
Mm-hmm.
and I just want to break down kind of what you said as far as you said it is broken for most people, but for the people that designed it, it's not. And let's look at that. So we talked about this briefly, but I want to break it down really simply because I think it's important to understand. So there were laws passed to try to control the cost of
Yeah.
health insurance, right? And so they said, hey, I think it was 15% originally. I think with Obamacare, it might have went up to 20%.
20%.
That's the most that they can actually keep as profit,
Mm-hmm.
right? And so what happened is maybe care, let's say it was $1 billion. Well, if it was $1 billion of health insurance monies that were brought in, they could keep somewhere between 150 to 200 million dollars.
Mm-hmm.
That would go to them. Well, as soon as that law gets put in place, and you said, "Wow, well, we can only make 15 to 20%, no matter how good we are
Right.
at running a health insurance company." That means the only way to make more money is to increase the cost. Because if we can take it from $1 billion
Mm-hmm.
to let's say 100 billion, now instead of making 150 to 200 million, we're making, you know, 15 billion to 20 billion, right?
Right.
And so the more expensive healthcare gets,
Mm-hmm.
the more they have the ability to have margin. And so, and again, I think that most people in health insurance companies are good people, and they're trying to, help people, and they're
Yeah.
well intentioned. But you can't ignore the truth of financial alignment and incentive, and that's what you're saying is as long as there's an incentive for healthcare to be expensive,
Mm-hmm.
it will be expensive because there's an incentive for it to be so, right?
Yeah.
And so I just think that's really important to see that of like while everybody's saying that healthcare is going in the wrong direction, for certain people,
Mm-hmm.
that's not the wrong direction. That is
Right.
the right direction. And I think that's probably really enlightening to a lot of people that have never thought about that of why our healthcare goes the direction that it does. Is I do agree that operationally, you will always see movement in the area of incentive.
Yeah. And there was a company called Blockbuster at one point. For those of us old enough to go to a video shop and look for a video, and when they heard about Netflix, they said that'll never amount to anything at first.
Mm-hmm.
Then when they had the
To
opportunity to
buy it,
buy
yep.
Netflix, they said, well, the problem is that we make money on late fees. And so we would be losing, our primary source of income by going to this model, and of course we know what happened is they just disappeared because Netflix,
Became so popular.
became so popular. And so the current system is in a similar position today. they are in a position where their business model is not great for consumers. There are better options that are already in existence.
Mm-hmm.
And they will either, try and buy us all up and shut us down, which is what happens many times. When somebody comes up with a
Disruptive
disruptive
model.
model,
Mm-hmm.
you buy it and you shut it down, or or they will get beat out by this, or they will join the movement. They'll do as IBM did once when their business model was being disrupted by mini computers as opposed to the supercomputer. They invested in the very things that disrupted their own model, and they grew that part of the business while the other part of the business ended up dying. So
Yep.
that's the position, that's the choice that the legacy sick care system has to make.
I love that because I do think that you can make money doing good,
Mm-hmm.
and you can make money getting people better. In fact, that's what people should do. Is like they get paid for delivering value, and in this case, in healthcare, the value should be getting people better. But it's going to require a fundamental shift in thinking, and sometimes those shifts in thinking are slow to come
Yeah,
because there's so much heavily invested in process, in people, in systems, that to try to say, you know what, we're going to try something else, it's
yeah,
just a really hard decision to make. But I love your example of Blockbuster because um, there's going to be a tipping point. Like healthcare can't keep getting more expensive.
yeah.
Like it can't. And so therefore, eventually, someone's going to come up with models that are going to disrupt it. And if they don't invest in those spaces, eventually they're going to be in trouble.
Mm-hmm.
And so this is an opportunity, not a threat. It's an
Yeah,
opportunity for them to reinvent themselves and invite and change healthcare for the better. So
yeah,
I love that thought process. Obviously, it makes sense in primary care. I think that's a great place to do that, where people are coming in somewhat regularly. How would you propose that it could be done, let's say, somewhere like pain care or surgery or hospitals? Like, how can that model scale into other lateral industries?
yeah. Well, I think the surgery is the easy one, and just to keep going with that same case, you put yourself in the position of the employer.
Mm-hmm.
The employers, in for many Americans, is paying for the healthcare, and if they're in a self-insured model, they're actually paying directly, like it's coming really out of the company's bank account
Yeah.
when you get that surgery. And so up until this point, people haven't really done much with that incentive, but now these employers are starting to understand, oh, I could get that same surgery for my employee for a fraction of the price if I just put some extra incentives in place. And in the case of this employee that I'm talking about, the incentive to them was, you can go with the hospital system, and your out of pocket is going to come out to 10,000 plus, or you can do this other option with a doctor that we trust, and it will be no out of pocket to you.
Mm-hmm.
And so that is that's already happening.
So
And
rather than the direct to consumer, you feel like it's direct to employer is the opportunity.
well, I think that for things like surgery, for things like hospitalization, I think the employer is in a better seat than the consumer to really uh, change where that industry is headed. However, I think it will move on to the consumers as
Yeah.
well, as they choose ways of paying for their healthcare that better align incentives as well.
Well, I mean, that's going back to the demand portion of this. Like, if you work for a company and 100% of your medical costs are covered,
Mm-hmm.
and you go to work for another company and you have the classic, you've got a $3,000 deductible, and then
Right.
it's 80/20, and you have to pay a portion of your check every month to that.
Mm-hmm.
You're going to go, wait a second, like over there I had every single expense taken care of, can't you
Yeah.
just do what they're doing?
Right.
And then the employers begin to get pressure to be able to say, if we want to be
Mm-hmm.
competitive against these other employers, we need to look for better programs for our employees.
Yeah.
And so then they start looking at that, and then as they adopt that, it spreads. And then as the employers are going to these healthcare systems saying, this is what we need for our employees, that's where that change begins. So
Yeah.
again, I do think that the power does belong to the patient and to the end consumer of any type of service. It's just where it's applied. And so, where their voice is not going to be very loud if they go to the insurance company and say this is broken,
Mm-hmm.
going to their employer, it will be a lot louder to say, hey, this is broken. What else can we do? Because those are people that care about you. They
Yeah.
want to have a competitive service. And so that's a great idea. I love that as maybe the instigator of change is raising your voice with your employer to seek out alternative options, such as what you're doing with the Free Markets Medical Association. That's
Yeah,
pretty
and I
awesome.
think it's going to be. I think it's going to be both because the consumers are not going to just let people make decisions for them forever. They consumers are going to want more and more control of their healthcare. And so it's going to happen on the individual level. That's why millions of people are going to a direct primary care model like mine,
Mm-hmm.
because they
They get
realize now that
choice.
they have that choice.
Mm-hmm.
Um, and then the employers, I think, in as opposed to going to the insurance companies and saying let's change things, what they're doing is leaving the insurance companies, and the insurance companies are wondering where their dollars went, and the hospitals are wondering where their dollars went when the employers are getting more effective, better priced healthcare for their employees
Mm.
by going to free market options.
That's fascinating, and I do think that from what we've talked about so far, there's definitely great opportunities. If anybody's listening and saying how they want, like, how does one even find like a direct primary care provider?
Yeah, you can search direct primary care,
Mm-hmm.
and you'll be able to find a website that
Let's
will
say you're an
give you
employer though,
directories.
and you're looking for a system. So, I mean, primary care is one thing, but
Mm-hmm.
like, there's different needs. So, we're an employer, and we have people that like we use a certain insurance,
Yeah,
and some people are like, well, I have my primary care, and other people have their primary care, and so you have the primary care needs, and maybe that can be handled by somebody like your company. But then you also have the obstetric needs
mm-hmm.
and the gyne needs
Absolutely.
and the surgical needs and all of these other needs,
Yeah,
that it's almost like you need to be fully direct and have that as an option, or having one foot in both markets, saying, well, we're direct for this, and we're with health classic health insurance for the other. That can be really hard for an employer to be in that situation. So, what's your advice to employers who are trying to find better solutions of healthcare for their employees? How can they go about navigating this market?
yeah. I think the easiest answer to say in a minute or two would be find a direct primary care provider,
Mm-hmm.
and they'll help you
Find the rest.
find the rest. Just because if I say go find an insurance broker that does unbundled self-insured plans that use proactive primary care methods, like that's a bigger mouthful to try and figure out how to go Google search.
Mm-hmm.
Those people exist and you can find them, but a direct primary care is a potential person who knows those brokers already and can help you find a broker that does proactive healthcare models. Another thing you can do is talk to your broker and ask him how he gets paid. Brokers are really uncomfortable with that question
I'm sure.
because the reality is that almost all insurance brokers get paid more when you pay more,
That makes sense. It's
and
commissioned.
so they are
It's
unlikely as a group to want to bring you to a model that lowers your costs and makes healthcare better for you, because they have no incentive at all to do that. Many of them get paid additionally for every medication that your employees take.
oh my goodness.
Your 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 employee goes to the pharmacy and fills a script, and $1 goes into your broker's bank account. This is a real thing that happens, and what that broker did to earn that dollar, was sell you on a system that doesn't incentivize anybody to be healthier.
Wow. So I mean, I find that fascinating. I'm sure other people do as well. Let's shift gears slightly to really the healthcare model in general and how people can try to live a healthier life. As a primary care, and especially, your incentive is to help people live healthy.
Yeah.
right? Which is great, and that's what I would hope every doctor had the incentive to help their people live healthy. But let's talk about some of those things that for people that say, like, what is the advice that you would give the general, American to say, where do they start on trying to live a healthier life to where they can bring down the cost of their health insurance, they can maybe spend less money on, chronic illness and stuff like that. Where does one even start with that?
Yeah. Well, you know that everybody listening can list 3 ways that they can be healthier today, right? Uh, Everybody that's out there knows, yeah, I could probably get a little more exercise. Everybody knows, yeah, I could probably eat a few more vegetables. And almost everybody is aware of that if I go to bed
Get sleep.
and get a little more sleep, I will be healthier than I currently am. So that is, that's common knowledge, and it's not going to blow anybody's mind if I say, well, you should eat better and exercise and get better sleep. I think what people are missing maybe is not the knowledge that those few things will make you healthier. I think they're missing the understanding of how much healthier they really will be,
Mm,
how much that will drastically change their life. And I think that they are missing just the basic consciousness of how what's important to them will be better if they change a few of their behaviors.
yeah.
And so I talk to my patients a lot about what's important to them. What do you want? Uh, you want to see your grandkids grow up. You want to be able to be healthy enough to go on a walk with your wife. Those are some things that people might think about. And then we just look at your day to day. Okay, what time did you set aside today for ensuring those things are going to happen in the future? And so I think that it's really just a matter of figuring out what you want and investing in it.
Yep. Like, when you look at it, is it what's worth more to you, like watching that one more Netflix show, which is super fun and immediate gratification,
Mm-hmm.
or going to sleep that hour earlier and saying, I'm going to get an extra hour of sleep? In the
Right.
short term, it doesn't make much difference. But in the long term,
It's
it
a big
massive
difference.
difference,
Yeah.
right? And I think that's what you're saying is that's the type of investment.
Mm-hmm.
I'm going to invest in an extra hour night's sleep because it's going to have exponential health benefits that it's even hard to quantify
Yeah.
the impact of how much that would be. And then it's like, every cell in our body gets remade. I think, what is it, like every 180 days or something like that?
Mm-hmm.
Again, I'm going to be wrong on the number, but again, every year, let's just say our cells are turned over and over again.
Yeah.
And where does it make those cells? It makes them from what we eat,
Yeah.
right? And so if we're eating terrible food that doesn't have nutrition and we're, deficient in certain vitamins, well, our
Mm-hmm.
body can't make the cells as healthily as it needs to because it doesn't have the building blocks. And if it
Absolutely.
doesn't do that, it does the best it can in creating those cells, but they're going to be unhealthy and they're going to
Mm-hmm.
break down. And so what you eat one day, eating and splurging on a big ice cream sundae, probably not going to do much.
Yeah.
But if you eat terribly day after day after day, that's the building blocks you're giving your body to build your body.
Right.
And so that's a huge difference. And then the last one you said, I think, so big is exercise, right? And it's the motion is life for joints and tissue, right?
Mm-hmm.
And so if you're not moving, your cells are not going to be healthy. And
Right.
so I love those three areas. And, if I summarize what you said, the biggest issue people have is not realizing, they know it's important, but they don't realize how impactful those things really are for their health and well-being in the long run. Is that
Yeah, and
accurate?
they're not putting their money and their time where their mouth is when it comes to you say this is important to you. Okay, well, many people are spending, 150 to $300 a month on a daily coffee.
Mm-hmm.
and and when I ask them about spending $100 a month to have access to a primary care doctor who will guide them towards long-term health, at first that sounds like a lot, partly because they're used to just paying insurance and not paying the doctor directly.
Yep.
But if you think about what's really important to me, and you realize that my health is really important to me, I can shift that $100 away from the the daily copy towards towards getting good primary care. And i'm I'm sensitive to the fact that $100 is a lot of money.
Yeah.
Like there are most of the nation does not have $500 in their bank account. So $100 is still a ton of money. I'm not taking away from that. What I'm saying is that almost all of us are spending more than that on things that are making us unhealthy.
Yeah, it's a good point. Like it's very well said in the fact that look at your Netflix subscription and how much you spend on that. Look at your coffee, as you said. Look like
Mm-hmm.
all these little things that really aren't adding value, but yet they do give us that temporary happiness. And
Mm-hmm.
there's nothing wrong with that. But if it's at the expense of your health, then it probably is. And so I
Yeah.
love that advice, especially from family practice doc, of saying like invest in those things that are going to keep you healthy for the long term, and that's how
Yeah.
you can live a better life. That's fantastic. That's great. Okay, so when did you start ARK? How long have you been doing this?
So we started 8 years ago, just over 8 years ago.
Okay, and how big has it grown?
Well, it has. It's now. It started with me and my friend Kirby, who's a phenomenal family doctor, and we were in the office by ourselves on day one. No patients and no other people working with us, and we grew it together for a couple of years, and then Kirby split into his own practice. It's called Simply Direct, a phenomenal practice to go to as well. A competitor, but a great practice. Um, and then and now I have two mid-level providers, a nurse practitioner, Hema, and Rebecca, who's in our Gilbert office. And then I have Dr. Felix, who's a phenomenal, particularly adult physician, but she does see some children as well. And then Dr. Bramwell is a great family physician who takes care of a lot of our patients. And so we have those four providers and a team of 12 people that take care of people, and we have patients all over Phoenix, literally in every nook and cranny, because we take care of some employers that have offices all over
Mm-hmm.
Phoenix. Um, so yeah, we take care of people all over town, and we've helped a few thousand people, and we hope to help a lot more.
That's pretty awesome. So yeah, you're here in Arizona. Do you have plans to expand outside of Arizona eventually, or?
I don't that doesn't seem like that's what we're headed towards. I think there's just so much work to be done in Arizona
Mm-hmm.
that it doesn't seem like that's an area I'll be spreading my work out towards. But
Yeah. So
um,
your goal is really, it sounds like, help the community here, be a part of the community.
there's so much to do. There's 4 million people within 20 miles of where we're sitting, and they need better health care.
Absolutely. Well, and I think healthcare's better healthcare is a passion project for you as well. I know that you've done really trying to improve medical education around the world and improve access to that. So maybe the last little area I'd love to ask you about, which is why is that important to you as far as um, medical education, improving access to healthcare? Like, where'd that passion come from?
Yeah. Well, um, I believe that you and every other person in the Phoenix area and all over the world are God's children. That you are a brother, and that your well being is um, is as important as mine, and is one of the reasons that I'm put on this earth at all, is to be there and do whatever I can to help you to be as healthy and happy as you can be.
Mm.
And um, and I have just seen healthcare as the area, at least, that I can make the biggest impact on the well-being of God's children. Um, and I think there's a lot to do, and I think that we can make a big difference in that area. And so that's where it comes from. It's I want to see people get the best chance to be healthy, to have a healthy mind that allows them to do what God put them on the earth to do, which I don't think in most cases is to sit in bed and be sick. And so that's the purpose behind what we're doing.
I love that. Yeah, humankind is one big family, and we should treat each other like so. Like if we all treated each other with love and respect, and as a family, like what a better place we would have. But I love what you said, which is we weren't put on this earth to sit in bed and be sick, right? There's a greater purpose for each of us to be able to go out, do something, create value in our communities, and create relationships. And so I love that that's your mission and that you get to share that. One other question that I love to ask everybody that comes on the show is so, as a pain management group and multi specialty pain management, one of our the causes that are really close to our hearts is trying to solve the opioid epidemic, right? So, there's over 100,000 people dying from opioid related issues. As a primary care, I'm sure that you see people that are in pain.
Absolutely.
In your opinion, how do you feel like we can help solve the opioid epidemic?
Yeah. Well, I can tell you about one patient who came in to me with some pretty severe back and knee pain. And this is a guy who potentially could have ended up on the route towards opiates as his main solution for this. And what we talked about the first time is, hey, there are medical solutions out there, there are interventional solutions out there, but I want you to try changing your nutrition,
Mm-hmm.
exercising, and see what that does with your back pain and your knee pain. He came back a couple months later and he says, I don't believe it. I've had this pain for years, and I started eating more vegetables and I started moving a little more, and I feel better than ever. I just saw this guy. This was a couple of years ago that this happened the first time. And I just saw this guy a week or two ago. And I said, hey, what happened to that? Was that kind of a fluke? And he said, no, my back pain, my knee pain has stayed away for the last couple of years, except for when I revert back to not exercising.
Yeah,
And now, there's real mechanical things that cause pain.
for sure.
And sometimes, the real intervention is to do an intervention. And sometimes you just need a medication to help you sleep through the night. I've taken opiates before, when I had pain, and I was grateful for them.
Yeah, opioids aren't evil.
Right.
It's just the excessive use or prescribing them when they're not needed,
Right.
or the complications that come with them. That's the
But
problem.
but if you have a relationship with a primary care doctor, or just an understanding yourself of the idea that the opiate is a band-aid, a potentially dangerous band-aid,
Yeah.
and that the real goal is to move towards a lifestyle that's going to help you get out of pain, and then you start looking for long-term solutions in lifestyle, and and potentially just more root cause solutions in interventions that might actually address where you hurt, as
Mm-hmm.
opposed to just the whole body.
Yeah, I mean, like you just talked about nutrition. I think that there's a huge disconnect in how much inflammation, which is where a lot of our pain comes from,
Yeah.
actually comes from our diet
Yeah.
or exercise, right?
Mm-hmm.
So if you eat a really inflammatory diet, small aches are going to become big aches,
Right.
right? If you aren't moving, then that inflammation is going to sit and become chronic rather than circulating. As we move, we circulate fluids, obviously, lymph nodes, blood supply, everything moves that inflammation through the body, and we can clear it. And
Yeah.
so, yeah, diet and exercise, I think, are huge. For us, one of the big answers is collaboration. We believe that so many times when you're in your own bubble as a specialist,
Mm-hmm.
whether it's family practice or, you know, surgeon, orthopedic, and stuff like that, you see the patient, you see what's in front of you,
Mm-hmm.
but not necessarily what every other doctor around is working. And so we
Right.
believe that good education and then good collaboration between providers is one of the best ways we can solve the opioid epidemic, because you've got all of these great providers doing their best to help patients. And when they actually can talk and communicate and collaborate, we believe when doctors talk, patients win.
Yeah.
And I think that's such a big thing for us. But I do love your perspective on how treating the root cause through good diet and exercise can be for a lot of people, it can be one of the answers of how you avoid even getting on the opioids to begin with,
Yeah.
because you never get to the pain, at least the severity of pain that would cause that. So it's a fantastic answer. So thanks for sharing that.
Thank you.
Okay, one other question. If you weren't able to become a doctor,
Mm-hmm.
that wasn't on the table,
Yeah.
what would you do?
I would write books.
You'd write books?
Yeah.
What type of books?
Well, I've got a lot that I would love to write, but the books that I'm hoping to get written sometime, despite becoming a doctor, are about some of the simple ways that we can have a healthier, happier life. So
that's awesome.
That's hopefully, to be announced someday.
Well, hey, if you write it, I want to read it. So, I mean, after talking with you today, I would love to see that. So, if you're looking for any test readers or anything, please include me. I'd love to read what you have.
Sounds good. Thanks.
Yeah. Thank you so much for coming on today.
Thank you.
Awesome to hear about what you're doing, and really wish you the best of luck in growing this, because it sounds like it's going to make a big difference in our community.
Thanks. I appreciate it.
Absolutely.